Good morning, everyone, and welcome to our March DIME webinar. We are absolutely delighted today to be welcoming Tom Millar from CISA to walk us through some resources that could not be more important at this time and at this juncture. So before we go ahead and introduce Tom and hand the reins over to him to run today's session, let me walk you through just a few housekeeping items in order to get you all situated and positioned for really good participation before we hand to Tom. So first of all, just to let you know, this session will be recorded. The great thing about that is the slides, and of course, Tom's remarks will be available on DIME's webpage after the session ends. The second piece is we have left some time for Q&A at the end. So please feel free to raise your hand, not like this, but in the participant list. I'll be watching for that when we do get to discussion, and we'll unmute you and give you the opportunity to pose your question to Tom live. Failing that, if you're somewhere that you can't speak, then definitely please type your question into the chat box and we can answer them that way too. So without further delay, Tom, we are absolutely thrilled to have you here. I can't imagine how busy your teams are at the moment, but I think the fact that you are here to walk our community through all of the resources that are available is absolutely fantastic. We are grateful for your time. We are grateful for your expertise, and we are thrilled to learn more about those resources that are available. The topic of sort of securing healthcare systems in the digital era could not be more important at this juncture. So with that, Tom, perhaps I could hand to you, introduce yourself, tell everyone on the line what you're working on, what your priorities are, a little bit about your background, and then we'll dive into the meat of our discussion.
All right, I'll try to keep it short because I'm sure people aren't that interested in how I landed here. But I guess about 20 years ago, I started out in the intelligence business, and then ended up working in the cybersecurity business before it was called cybersecurity. And I joined a little team called US CERT, which was part of Homeland Security. And that we were in charge of trying to ensure that we had a safer and stronger internet for all Americans, and or at least that was the motto I gave us at the time. US CERT eventually became part of what is now the Cybersecurity and Infrastructure Security Agency, or CISA, is what we call ourselves. And we have it. Basically, we do what it says on the tin. We're in charge of safeguarding critical infrastructure all across the United States. From cyber threats as well as physical threats of different types. And my role at CISA is I'm a senior advisor in vulnerability management for cybersecurity. And so I specifically focus on, well, right now, what I'm doing today is I'm trying to evangelize our free resources, tools, and services that people can use to make sure that they're not low-hanging fruit for the adversary, as we like to say sometimes.
Apparently, I can't remember how to use Zoom. I think that turn of phrase, Tom, is really terrific. You know, trying to avoid being low-hanging fruit for the adversary. So with that, let's go ahead. I will fully hand the reins to you. Do you want to talk us through what you're going to be covering today? And then let me know, I'll stop sharing the slides and you can go ahead and dive into all the content that you're going to educate us on today.
Sure. So I'm highlighting the key points because I want to tell you what I'm going to tell you before I tell you, so you're better prepared. We're going to be talking about the stopransomware.gov one-stop shop site, because especially in the healthcare space, the top 3 threats we're concerned about for healthcare and healthcare delivery and are ransomware, and ransomware, because those are disruptive and they can have a powerful impact on patient outcomes. So we've seen this happen to real hospital networks in the real world, and it's a grave concern, especially in these times. We're going to talk about specifically tailored healthcare resources that we developed at CISA and in partnership with Healthcare and Human Services. We're going to talk about some of our special pragmatic cybersecurity things that you can do, which is the bad practices. We're going to be talking about stuff off search. I'll explain that in a minute. The tabletop exercise package set, which allows you to run your own exercise program and follow scenarios that were developed by CISA, including ransomware scenarios, but also insider threat, other types of things like that. The cybersecurity evaluation tool, and no spoilers, I'll save that until I get to the right point in the presentation. Cyber hygiene services, our free alerts and bulletins that you can subscribe to get timely information on the latest threats and the latest vulnerabilities, and also how to get in touch with our regional offices that are all over the country, and CISA Central, which is basically like our 24/7 800 number. Call us, report an incident, call us and report a vulnerability, or ask a question that you might have of CISA. Can I get help with problem X? So with that, I'm going to share my screen for a bit. We're going to go on a guided tour of our resources. And here we go. Can everybody see my screen? Perfect. So what's a CISA? This is a CISA, CISA.gov. And right now, our big message is shields up. I think what we'll do is we'll probably loop back to that at the very end of this presentation. Shields up is our message we're broadcasting to everyone as part of as our approach to the current geopolitical situation, the big elephant in the room, so to speak. But right now, we're going to go and we're going to pretend I clicked on this bubble down here, the Stop Ransomware one. And this is the Stop Ransomware site. So I know up here it says, Stop Ransomware, CISA.gov. If you go to stopransomware.gov, it bounces you right to this page. And there's tons of resources here. We have our guides, guidance and resources like the specifically ransomware protection and response, which is created by our partners at NIST. We also have guidance from Secret Service. There's a ton of resources here, but I'm going to take you directly to the ones that are specific to healthcare first. And I advise everybody to check this out. If you're concerned about ransomware, if that's still something on your list of things that keep you up at night, and there's no reason it shouldn't be, absolutely check out this page and look through it for all the resources. I'm going to show you things that are tailored to healthcare, but the advice on this site, the resources on this site are evergreen. The ransomware guide in particular, this is a ton of great information. It gets into technical detail about how to avoid getting infected, detecting a ransomware infection, what steps to take. It's a fantastic guide, and it was developed originally for state and local governments, but it's actually really powerful information for any type of organization, and it's sort of like a portable template. So basically, you take the same advice that's in our guidance here, apply it to your own organization, and you'll be 99% of the way done with your homework. So if you go to the campaigns page, so going back here, scroll down, you'll see there's a spot called campaigns. Campaigns is where we put our specific tailored resources, mostly focused on K-12, because they get hit with ransomware all the time and it disrupts their operations, and healthcare. And the healthcare resources page looks like this. And you see this this somewhat jejune graphic of the hospital that is closed for business. We don't want that to happen. That is not a funny image. It is just sometimes our graphics department has to make something look cute even though it's not. And we did this, a lot of this is in partnership with Healthcare and Human Services. Tons of resources with 405D partnership, the health sector cybersecurity coordination center, and a ton of supporting products for the types of ransomware and things like that we noticed that were affecting the healthcare sector the most. And I want to highlight real quick this one simple template we created for healthcare organizations to basically be like, you take this or a version of it, print it out or make your own copy, have a hard copy of this with the contact information filled out for who takes care of each role, including obviously contacting our help desk, so to speak. It's not really a help desk, but I'll call it that for ease of use. And you fill this out, and it's basically all the people you need to contact if the worst case scenario happens and you are put in a situation where you're actually responding to a ransomware incident. So that's the reason we put this guide together. Now, what we'd really prefer is that nobody gets afflicted with a ransomware incident, And now I'm going to talk a little bit about the ways you can avoid that. First of all, first and foremost, is our bad practices. We put this together actually as part of the CISA COVID task force that I had the experience of being part of over the last year or so. And we put this together because these are three, like everybody's heard of best practices in cybersecurity or best practices in healthcare. The bad practices are the opposite of that. These are things you absolutely should not do. The reason being, this is a short list of things that will get you compromised. It's not a matter of if, it is a matter of when. And it's a really simple list. It's just three things: use of unsupported or end-of-life software, use of known fixed default passwords and credentials, and the use of single-factor authentication for remote or administrative access. These are three simple things that organizations all over the country and every critical infrastructure sector have, to some degree, still employ these practices somewhere in their infrastructure. And what we want to do is start having these sometimes difficult conversations about stopping the use of these practices, because this is what, when I talk about low-hanging fruit, doing these things makes you the low-hanging fruit. The next thing I'm going to talk about is our stuff off search resources. And again, these are all, by the way, really easy to find. This is obviously, you can just go to CISA.gov and look for bad practices. Stuff off search, you can just go to like CISA.gov and search in our search bar for stuff off search. I think that's enough times me saying search. So this is, if you've ever heard of Shodan or Census or Thingful, these are search engines that are specifically designed to pick up Internet of Things devices, supervisory control and data acquisition, which is a type of industrial control system, and remote access technologies and other critical assets like your mail servers and other infrastructure. And they find those things, they make it basically publicly searchable. So we created, as it says right here, you want to know what your adversaries know? Learn how to use these search engines, find your own stuff on these search engines, and then mitigate that by taking them off. And that's by hiding it behind a firewall or otherwise obfuscating your sensitive assets so that the adversary can't easily search for all your juicy bits on the internet. So there's that. The next thing, the last pragmatic thing, well, they're all pragmatic, but the last part of our pragmatic package, if you want to call it that, is our tabletop exercise packages. And this does what it says on the tin. We have, so most of these were prepared, if you can guess, most of these were prepared by the physical security folks, which is why we have so many scenarios for physical security, but you do have various scary healthcare and public health scenarios on the physical security side, but you also have all the cybersecurity situation manuals that let you run various types of cybersecurity threats through a tabletop exercise program. You know, you can sit down with your organizational leadership, step through these and figure out, you know, like what are we missing in our incident response plan? What are we missing in what are the gaps in our procedures? So this is a really powerful tool. We don't have the resources to go out and run exercise packages or run an exercise program for every part of critical infrastructure in the United States. That's why we created this, so that everybody has access to the tools we would use if we were running a program for you. You can just do it yourself. And that's a wonderful segue. How did I think up that? Speaking of do it yourself, it's our cybersecurity evaluation tool, or what we call the CSET. And this has just been updated. So it took my favorite part off the top of the list, but we created the ransomware readiness assessment last year. Again, unlike some things in government, this specifically does exactly what it says. Now, if you've ever gone online and you've been a little bit bored and you decided you were going to take a personality quiz, it's actually not that far off of that. This is a questionnaire. It's an online standalone questionnaire. You answer the questionnaire. It's actually assessing your security practices according to standard packages we have developed or that our partners have developed, like the Transportation Security Administration is one of them. Not that that applies to this sector, but you get the idea. And you walk through the entire assessment, and you answer all the questions to the best of your knowledge about your organization. It gives you recommendations, tells you where your gaps are. And here's the best part: nobody at my agency has to know anything about your answers. It's entirely your data. It's your information. It stays exactly where you want it to be. So it doesn't feed back to us. On the other hand, I am going to talk about our cyber hygiene services, where, and this is really, really powerful stuff. These are all no cost services. We do use your information to find out more information about your network and your systems, tell you that information, and then it's strictly between you and us. This is probably the most important thing I can say about these cyber hygiene services before I dig down into the details of how they work and what they do. But you have to understand that your data is safe between CISA and yourself. It's your data. Your organization owns the rights to that data. We're not going to tell it to a regulator. It can't be used for civil action. It's all under sort of, it's not quite attorney-client privilege, but it does approach that, right? The rules of engagement say so. So vulnerability scanning is very straightforward. This basically, you give us the IP network range of your perimeter. We scan that for known vulnerabilities. The robots do all the work, and you get an automated report either on an ad hoc basis for high and critical vulnerabilities, or on a weekly basis for all other types of vulnerabilities. And this is a powerful, effective tool. We have blue chip Fortune 50 companies that use this, even though they already have a mature cybersecurity program, they have the resources. They're like, it's no cost. Why wouldn't I want another set of eyes looking at the perimeter of my network and telling me things that I may not be able to see, right? It might be able to catch something that I wasn't aware of before. So vulnerability scanning, extremely simple. The main thing is just signing up. Once you sign up and get through the legal paperwork exercise involved in that, it is an ongoing process until Congress tells us to stop doing it for some reason. We're going to keep doing vulnerability scanning, providing reports, because like I said, the robots do it. And web application scanning is a little more resource intensive on our side, but it's very similar. You give us domain names of web applications that you would like us to scan for known types of vulnerabilities. We do that, and we provide you a report. The difference is this is an instance basis as opposed to an ongoing basis. So the web application scanning happens once, you get a report. Hopefully you fix all that stuff. If you need another web application scan, you can come back and re-enroll at a different date. Phishing campaign assessment. This is 6 weeks of phishing at specific employees in your organization. And we tell you how susceptible your organization is to different levels of phishing sophistication. So it starts off with the very simple stuff, the scams that, like you would hope that your grandmother would be able to spot. And then it ramps up to the things that are very tailored, very specific, look like they might be coming from a legitimate source with a legitimate attachment that you need to pay attention to, that kind of thing. And then we tell you basically, the recommendations that come out of this are not just, hey, you need to give everybody more cybersecurity awareness training. Like we have tailored recommendations that are more specific than that tell you exactly like how you might be able to help your employees better protect themselves or better defend your organization against different types of phish. And the remote penetration test, this is on a schedule. You enroll, we put you in the queue. We get around to doing it when we can because it is more resource intensive for us, but all of these are scalable. We can scale and meet the needs of critical infrastructure with all these services. I'm just saying the remote penetration test might not happen the very week after you sign up for it. But the RPT, as we call it, this is actually a perimeter penetration test. We do reconnaissance. We do adversary emulation. We use the same tips and tricks that tactics and techniques that the bad guys use. And then we get one step further beyond your perimeter. We don't go after the crown jewels. It is not a heist or a full red team engagement. We go one step beyond the perimeter, tell you how we did it, and that's the engagement. And again, that's the price tag. But for being on this webinar today, you get a discount. So I'm going to move on to possibly the last two bits are possibly some of the most powerful things, and they don't require any sign up, and you don't have to download anything, and you don't even have to read anything except after you sign up. Just know these things exist. The National Cyber Awareness System is where you will find out what the latest known exploited vulnerabilities are, what the latest patches are for critical types of systems, whether that be industrial control systems, medical devices, or just commodity IT software. This is also where if we publish an alert on a specific ransomware family, it will come out through this system. And it's very straightforward. You just type in and you're done. Just hit sign up for specifically the ones you want of these different types. You can click on these and see what types of information is usually made available. This is what our alerts typically consist of. So you can check these out, see if there's something you want to sign up for, and then you'll be on the list to receive alerts when they come out. Obviously, there's also, oh yeah, it has to warn me whenever I leave our site, but you see the Twitter icon, you get the idea. And lastly, I want everyone to know about our regional offices. So CISA copied FEMA's 10 existing regions. This is how we've organized our field offices across the country. So we have regional offices everywhere. And this is sort of the tip of the spear of engaging with CISA in so many ways. We have cybersecurity advisors and protective security advisors in every field office. We also have field operations personnel who are coordinating activities across all these field offices. This is exactly where if you feel like you want a little bit more care and attention than just calling an 800 number that's going to go somewhere in the Washington, D.C. area, reach out to your region offices. All of their contact information is right here. And that it pretty much takes care of what I wanted to talk about today. That's all the resources I wanted to share. I would love to answer any questions about Shields Up and our other activities, as we are sort of in an enhanced coordination posture right now. And yeah, over to you. I'm gonna stop sharing for now.
Fantastic. And I wish I had been a better partner and was standing by to drop some links as you were going. Let's make sure we do that perhaps before the end of today. I wanted to sign up for those alerts as we were going. So this is fantastic. And I'm keeping an eye on the chat function and raised hands in case any questions do come in. I'm going to take some moderators' liberties in the meantime, if I can. You know, what's fantastic about all of this is how, as you said, sort of practical and pragmatic it is. It's all open access. I also love that there isn't any liability or risk really with doing this. These tools aren't intended to sort of result in a gotcha moment. They really are there as a tool, as a resource that folks can come and use. It's terrific. I wanted to start by asking you, CISA is a fantastic agency because there's the ability to look across different industries. To the extent to which you're comfortable, like when we think about how we're protecting our infrastructure, when we think about our security protocols, like what's the health of the healthcare industry sort of in these in relative terms compared to, you know, other industries out across the US?
One thing I've learned in this job is that a scary amount of critical infrastructure in this country is run on very razor thin margins. And I say that as a way of introducing the concept that healthcare is not doing that bad compared to a lot of other sectors, because everybody has a workforce crunch when it comes to cybersecurity. I think our director, Easterly, our agency's director, has a really strong people focus. And I don't want to. I don't want to take any credit for her insights, but I have also been saying for several years that everything boils down to a people problem, because what I've seen for several critical infrastructure sectors that I've had the opportunities to interact with fairly closely, it comes down to, it's like there is a State and local governments are one example. A lot of supply chain companies are another example. Healthcare is a third example, where the people running IT are doing it just sort of like as absolutely best they can with the limited cycles that they have, right? Because it's IT and cybersecurity basically like are an overhead. They're a cost. They're not an investment. They don't particularly bring value, especially if you're publicly traded or something like that. So it's seen as, like this is something that costs, that just subtracts from the overall performance of the organization from a physical perspective. So people are always trying to figure out, how can I save money on this? And we're saying, CISA is in the situation where, like, please stop saving money on cybersecurity. Please invest. So what our challenge has always been is, and I will get possibly a better answer to your question at the end of this, I promise. Our challenge has always been to find that balance between what is the right business decision that is also the right cybersecurity decision. And so anyway, I think healthcare overall, there are definitely some scary things that we've encountered in healthcare. A lot of it has to do with some of those bad practices I talked about, because there are so many things in medical technology now, as well as just in the way certain hospitals are run and the tools and devices they need to make use of, that are using legacy outmoded operating systems, for example, because that's the only, like, you'll find devices or pieces of technology that don't run on current versions of Microsoft Windows. So they have to be run on something that's outmoded. And it's a trick of, like, okay, how do we separate that from the rest of the network so that it's a little more secure, even though it has to be run on a end of life system. What was and also the use of sort of like weak authentication is another problem for any kind of embedded device. We see a lot of weak authentication in embedded devices, and that again applies to all sectors, but definitely also applies to healthcare as well.
It's fascinating hearing you talk, Tom, about how, in many cases, this is more of a people problem than a tech problem. I was thinking that as you went through and, talking about that sort of that low-hanging fruit, we all inherently know that things like two-factor authentication are, good and important, that we shouldn't be using, our dog's name and their, our sort of exactly our anniversary or whatever it is, as our passwords, yet we know it's still happening. And, I find that absolutely fascinating. And I want to drill down on that in a second. I want to get to that. And also, I want to talk about this idea of prevention. It's something that we are really challenged in healthcare generally to invest in, whether it's on the clinical side, and now we're learning on sort of the cybersecurity side. But we've got some questions coming in. So I'm going to go ahead. Smit, you've got a great question in Q&A. I've unmuted you, I think, on our side, if you want to go ahead and ask that live of Tom.
Absolutely. Tom, thank you so much for great insights. And I cannot wait to dive into a lot of these resources that you shared. One of the questions I have, and my name is Smit Patel, so that you can see where I come from. I'm a clinical lead at Dime, and engage a lot with innovators community, early stage startups, people who are designing some of these medical devices and products. For those colleagues, they essentially don't have expertise in terms of their FTEs and teams who understand cybersecurity, who understands data privacy, who are experts in those early stage startup teams. For those companies and vendors who are serving health systems, serving other organizations, if they want to prepare themselves for better regulation, for better cybersecurity considerations to make sure that they are not the leak into the larger organizations that they serve, what recommendations you may have?
Oh my gosh. I'm sorry. I would like can we try the question again and just sort of like, compress that just a little bit for me? I'm sorry.
Yeah, absolutely. I'm so sorry. It was a very long question. Essentially, to compress that, early stage innovators, if they are thinking who are serving larger organizations like health systems, who are creating some medical device, for example, if they want to be more secure, if they want to be better vendors, what are some of the recommendations you have that they can have as good hygiene practices?
There is, I'm going to say, go with NIST. So the National Institute for Standards and Technology, which just so happens to be where my wife works, because it's Washington, D.C., and we're all nerds. But they have issued guidance just recently. Actually, it came out in February of this year. They have issued guidance on Internet of Things security, and I think starting down that path of looking at what NIST, like looking at the prior art of what what your own government is publishing about what are the guidance for Internet of Things technology and things like that, or Internet of Things security, is a great place to start to understand sort of like how to, we call it threat modeling. Like, what are the ways that my device or my system could infect the environment that it's placed in? Those are great places to learn how to start doing that, thinking through those processes. And since I said threat modeling, I'm going to say, like, there's actually decent amount of literature out there about how to do threat modeling that applies not just to commodity, well, I call them commodity, but like common types of IT systems, but also applies just as well to Internet of Things, or it could apply to a medical device or any type of thing that an innovator might be thinking of. A lot of it's very like at a level of abstraction, where once you learn how to do threat modeling for something like a Microsoft product, then you can do threat modeling for just about anything.
Fantastic. Thank you so much. We'll definitely dive in and appreciate your insights.
Thank you.
And that's a great question, Tom. So you're aware, and as a reminder for folks on the line, DIME maintains a library of digital health resources. And so I've made a note, we'll get those NIST IoT sort of security recommendations in. We'll also make sure we actually have comprehensively listed everything that you guys have from CISA, everything that you flagged for us today. We'll get those over there as our action item, and trying to be sort of good partners as a result of our conversation today. We've got a question in the chat from Kat Cole. She isn't somewhere she can talk right now, so with her permission, I'm going to give voice to her question, and then we've got another one in Q&A to follow. So Kat Cole is actually our tech lead here at DIME, and she's been sort of looking into becoming more knowledgeable, really protecting our systems here. She's got a really good question around your opinions on sort of cybersecurity certifications. For anyone who is in-house, who is wanting to sort of, grow their muscle around being a good tech lead, doing right by the organization in terms of infrastructure and security improvement, what are your thoughts on those cybersecurity certifications?
This is a sticky one for me, because as a government official, I cannot be seen to endorse any sort of private certification or anything like that. I am personally, I can state as a matter of fact that I am personally a CISSP, which I forgot what that stands for. So, but there's also the several of my colleagues have the CISM, and a lot more of my colleagues have the Security Plus certification as well. So all of those I think are valid, and there's several out there. I don't think there's any one of them that is particularly worse than any of the others. I think the thing is that they're all fairly challenging, and if you learn the literature that goes along with one of them, you're quite likely prepared to tackle another. I see there are a lot of people that have like 4 of them all lined up in a row on their business cards. Personally, for my sake, that is quite a lot of money to spend on standardized tests. So I would say, like, if pick one, whichever one sounds good to you, and have a blast and good luck.
I love that. So, recognizing that you can't sort of recommend these things on principle, those certifications, the content that comes with them is a really good way for folks who really want to take this seriously and to secure what they can, to go in and learn more. It's not about stacking up the credentials, but it's about sort of really becoming knowledgeable, and that's a good pathway to do it.
Exactly. And I had a conversation with a fellow CISSP, and we were actually complaining about the boot camp method of instruction that goes with some of these certifications, where they basically stick you in a room for a week, prepare you specifically to pass the multiple choice test. Then you pass the multiple choice test, and then you're done. And it's sort of like it goes in one ear and out the other. And that's really not that's not the goal. It's, like understanding the core principles and being able to apply them, not just pass the test.
Yeah, that's it. I mean, because the threat is very real and the risks are very real. And going back to that image that you sort of made light of, but I think we all agree, the hospital with the closed sign, that's the risk, right? I almost think about being that individual. You don't want to be carrying the can for that, right? You want to be fully prepared. You want to be able to apply that knowledge. So as we build our teams, as we think about capabilities, it really is applied knowledge, not just sort of rote knowledge. I think that's, Tom, really good guidance for all of us who are working in this space right now. There's a terrific question, and there's a couple of terrific questions in the Q&A. I'm going to go ahead and go to Daniel first. Daniel, I've unmuted you. If you want to pose your question live to Tom, please unmute yourself at your end and do so. If not, I can go ahead and do it for you. Okay, I'll go ahead and do it. I'm never quite sure of the right time to see whether someone's struggling with mute or whether they can't talk, and that's fine. Daniel, it's a great question. Daniel says, thank you for the insightful sharing, Tom. Daniel from NTU Singapore. He wanted to sort of pique your thoughts on wearables in particular. So how do we ensure consent and we consent and protect the security of multinational users, specifically data used in research? So this has been a lengthy discussion here as we start to explore regional research on wearables and hyper-personalization of digital health.
Listen to your IRB. I would say, I don't, unfortunately, I am not involved in the type of work that you're describing very often. Usually I'm at least arm's length away from that type of research because we're not a research organization ourselves. But your institutional review board will be the guiding light on how to make sure you're protecting the privacy in accordance with whatever the multinational laws may be, and to the best of whatever duty of care is required.
Tom, and it's a really thoughtful answer too. And I also think it reminds us of all of the different sort of humans that we have to bring with us in terms of dissemination of knowledge and best practice, and all of the different people who have responsibility in this realm. As you say, sort of you yourself and then CISA have this amazing in-house sort of capabilities. You've walked us today through all of the resources you make available to the field, but then there's all of these different ways that we're applying these new tools. There are all of these different ways that we're creating sort of endpoints, right, that feed into healthcare systems, whether it's through research, whether it's through routine care, whether it's in a moment of public health crisis, right? And so we have to make sure that we're bringing everyone with us. So Daniel, absolutely terrific question. And Tom, I think an appropriate and thoughtful answer, and a reminder that we can't do this as a sort of N of one. You being here today, I think, is a great example of the need to be able to share knowledge across silos, and we need to bring everyone with us. Tom, I'm going to give voice to another really good question here in the Q&A. I'm not sure who asked it. If someone wants to give voice to this, just throw your hand up and I'll call on you. But otherwise, I'll give it my best voice. Yes. Let me see. Oh, Rebecca, this is you. Let me go ahead. I've unmuted you on my end. You should be able to unmute yourself on your end and pose your question live.
Hi, Tom. I'm a fellow Dimer here, and as you can tell from my accent, I am British and based in the UK and Europe. So I wanted to ask about the global reach of these systems. Obviously, the internet, very much a global phenomenon, but I'm also conscious that you work for the US government, so quite understandably, your priority is to American companies and American citizens. So I just wanted to ask if there were any limits to these tools for those of us outside of the US, and are there any kind of non-US focused equivalents?
Right, that's a really good question, and I'm glad you asked. Unfortunately, the cyber hygiene services that I talked about are pretty much only available to U.S. critical infrastructure firms. So if where you're located, you would probably want to go see if the National Cybersecurity Center in the UK has similar service offerings, and I think they do. I believe they have some similar service offerings for UK critical infrastructure. In Europe, I mean, like your various local cybersecurity agencies, our counterparts all around the world, have varying degrees of similar resources and capabilities appropriate for their own critical national infrastructure. And but the nice thing is everything else is squared away. The thing is, like, we only get resources to apply the cyber hygiene services for domestic critical infrastructure, but we know for sure that we have lots of international partners who subscribe to the National Cyber Awareness System. We have had international partners download and use our cybersecurity evaluation tool, the CSET. All the other stuff that's out there, you know, have a blast. So it's just the cyber hygiene services that are limited to domestic.
Thank you.
Fantastic. Bex, terrific question. And also that helps us, Tom, as we organize our resources to make them available. Everything's open access, right? Those cyber hygiene pieces are for critical US infrastructure, but there are sort of partner orgs that actually we should research and perhaps make available to our global community. So Bex, absolutely terrific question. Thanks so much. Kat, I know you aren't somewhere where you can speak right now, so I will give voice to your question here in the Q&A. Another one from Kat, Tom. How do you suggest balancing compliance with increased security measures? So Kat goes on to say, and the voice of experience here, in an ideal world, everyone would understand the risks and use the increased, and she acknowledges, albeit annoying measures. But as we know, these can be time consuming and people often find a way around them. But how do we do that behavioral change, right? How do you think about optimizing that balance that Kat has teased out here between compliance and like appropriate security coverage?
Oh, it's really difficult in some industries. I personally have never had to enforce a HIPAA regime and do cybersecurity at the same time. I can only speak a little bit to this, but I think that the challenge we face in various industries is basically is teaching the culture of putting cybersecurity first, and then finding a way to make sure compliance is done as part of that practice. Usually, compliance should never get in the way of doing good cybersecurity. It's just a matter of, let's do the good cybersecurity, and with any luck, barring some crazy regulation that, you know, like unfortunately does, you know, inflict itself upon us from time to time. But with any luck, doing good cybersecurity results in complying with the standards, the other standards and privacy protections that we have to also put in place. I hope that's a decent answer. That's a tough one for me.
I really like that. And I think it helps us perhaps be, Kat says, excellent answer. I'm sure you could see that, but just to make sure I'm giving that feedback. And I want to build on that if I can, Kat. It's a really important question here, which is, barring waiting for an enormous sort of cyber catastrophe, and bear in mind, like, there are small fires all the time, right? I don't think we hear about them as much as perhaps we should in order to do some of that behavioral economic sort of nudges, that behavior change, to really land the punch on how important something as simple as two-factor authentication is, and the fact that it's worth going to a government website to get an open access tool that could be enormous in terms of risk avoidance. Like, have you thought a little bit, has CISA thought about how we actually win hearts and minds? Like, the resources are there, the risks are there. How do we sort of advance the field so that we say, actually, no, this is important, and my list of things that are important and my list of things of urgent, this is actually on the urgent list?
I will tell you, sometimes working at CISA feels a lot like that man on the street corner with the megaphone, and nobody knows what he's talking about, but he's just making a lot of noise. like we have a problem with our feedback loop here too. You know, like learning why, just knowing, like, you know, like we go out when we do our more sophisticated types of assessments for specific types of entities of concern. So we'll go out and do a real serious 90-day red team assessment on certain types of entities in critical infrastructure, and we'll deliver a very serious detailed report at the end of that. Here's all the ways we got to your crown jewels. And then it's sort of, you know, like we hope that they apply some of the recommendations that are in that report. But we don't, I mean, we're not a cyber regulator, far from it. We don't want to really be a cyber regulator, because that would defeat the whole purpose of sharing information freely with the private sector and having the sort of cooperative relationship that we do have. But yeah, like we need a better way to get that feedback loop, so we can find out, you know, like, hey, we told you these are the bad practices. We told you this is how we were able to infiltrate your network from our, you know, our trusted red team. These are the things that we asked you to do to make sure you had a better cybersecurity posture and you weren't low-hanging fruit. Why couldn't you do them? It's not a why wouldn't you do them. It's a why couldn't you do them, I think. And it's and sometimes it is that people problem. And in that case, then we need to be helping fight for that workforce pipeline solution to that, right? Sometimes it really is about, we need so many cybersecurity experts that we drive down the cost of cybersecurity experts, right? that might have to be one of the solutions to this in the long run. But you know, like whatever the reasons are that people aren't able to adhere to the recommendations and the information about vulnerabilities, especially that we put out there into the world, like that's an ongoing challenge for us to figure out. You know, like we've told federal agencies, the other federal agencies in the government, it's one of our primary customers. It's like one of the primary constituent sets that we deal with all the time. And we have really unique visibility into those networks and agencies, as they're our partners, and they also have to do what we say. The closest we ever come to being a cyber regulator is with these federal agencies. And we still see them doing things like, you've got a 30-day backlog of Microsoft patches. Why in the world do you have a 30-day backlog of Microsoft patches? And try to find out why that is. What part of their process is broken, causing that to happen? And you know, the more we learn, the more we can better tailor our recommendations and information that we put out there into the world. But yeah, it's a challenge.
It's so interesting.
That was a long non-answer. I apologize.
No, you got me thinking. I took a few bullet points, so brace yourself. It's so interesting to have this conversation in the healthcare environment, because, you know, first of all, I always, and certainly not a criticism, Tom, but we talk about this idea of sort of a people problem, and I use the language first. It suggests that they're sort of willingly doing something wrong. And it's not that they're just faced with an endless list of tasks in a given day and they're overburdened. Like, I even do it myself. I don't have two-factor authentication switched on and everything I should, because I'm kind of rolling the dice a little bit, because you got to get through the day, right? So there are these sorts of pieces. So then I think to the fact that you also don't see a sort of CISA being optimized as a sort of regulatory agency, that makes a ton of sense as well. But let's draw some comparisons with healthcare. In healthcare, we know that if we do really good screening and prevention, we can offset a ton of health, disease burden. But we don't do it because we don't have the incentives. We also know that world-class mental health and chronic disease management can offset all sorts of acute crises down the road, but we don't do it because we don't have the incentives to do it. And it's sad and it's awful. And you know, we could even say unethical, depending on my mood, I'd say it is, right? But the challenge is that those incentives don't exist. But then my mind goes to, if we're not going to sort of regulate this and we're not going to take a stick approach, what works in healthcare? You know, I think about things like there are the top 10 hospitals or the top 50, there are centers of excellence, right? Could we start to think about, you know, this is a cybersecure center of excellence, right? That your practices that you benchmark that are actually in the digital era of health, this is a clinic or this is a practice that you can trust, right? And that isn't at risk and that isn't going to go down. Like, I don't know if your team has thought about this, but it's where my mind goes.
Well, here at CISA, we certainly want to be a cybersecurity center of excellence, because if the CISA website turns into an obscene gesture one day, then that's a really big embarrassment, right? So we would like to think of ourselves as a cybersecurity center of excellence, but the problem here is, I think a little bit of the problem in the difference between healthcare, and I agree with everything you said, and we could talk about the mental health topic for days. So let's find time to get coffee on that one. But the issue with cybersecurity is that you have an active human adversary who is trying to thwart your defensive measures. And if you say, I'm a cybersecurity center of excellence, then you're absolutely painting a target on your back. So
that's so interesting. The moment you say it, it's so clear. You're like, come get us, we're excellent at what we do. And everyone's like, come get you, we will.
yeah, I mean, we just had some significant compromises of some major companies that have made the news, at least in the cyber threat intelligence world, and got a lot of people working overnight. And they were all for companies where it's like they were critical parts of sort of the cybersecurity or the cyberspace supply chain, right? Including one company that is a multi-factor authentication provider. So if you were relying on them for your multi-factor authentication, then you also might be compromised. There's something like 300 companies that could have had their account management compromised by the hack of this one company that was acting as their multi-factor authentication provider. So it's a challenge when you are up against another human that is actively trying to thwart your countermeasures.
I love that from a storytelling point of view when we think about communicating with our community. So I have one last question, and actually, Casey, I see you here on the line. I'm going to unmute you from our side in case you want to jump in on this. Certainly no burden. I don't want to put you on the hot seat too much, but Tom, I think about the healthcare space is changing, and I know that you talk about sort of infrastructure and security at the institutional level, but as I think about what is happening in the digital era of healthcare, there's a lot of people using a variety of different connected tools and resources themselves independently in their own lives to try and promote their health. Like, how do we actually think about, or have you thought about the role for educating everyday sort of people across the country on this, so that sort of their health data in particular can be appropriately safeguarded? What are the best practices that we should be communicating to anyone who might want to use a nutrition app or might want to start monitoring their activity, perhaps without realizing all of the data that they've also just given permission to, or the vulnerability that they've exposed themselves to? Is that something you've thought about before?
We have done a little bit of, well, I shouldn't say a little bit. We've done some thinking about that, and what would be the best approaches to trying to teach a wide range of people how to better safeguard their data. The thing is, at the end of the day, CISA is focused on critical infrastructure. And so the general population isn't always the number one priority. So like individual private citizens and what they should do to safeguard themselves, we absolutely have awareness campaigns focused on that and around that. But right now we're in a transition phase for our awareness campaigns and try and figure out what the next steps are going to be. Most of them are around, hey, use multi-factor authentication wherever you can, especially on important types of accounts like your bank. And don't use passwords that, don't use your birthday as a password kind of stuff. So, I mean, a lot of it's fairly basic. I would say if you're talking about, like, hey, questions to ask yourself before you go and allow all the app to look at everything else on your phone or something like that. These are a little bit trickier things that I think like we will be considering in future awareness campaigns to let people know how to avoid sort of the TikTok problem, right?
Oh yeah.
Everybody loves TikTok. It's hilarious. It's got tons of great content. It's all there for free. But it also snarfs up your data like crazy. Same thing with Snapchat. I think because I'm the cybersecurity guy, I mean, like I had to try Snapchat because it was all the rage a few years ago. I installed it for 45 seconds. And by the third time it was asking me for permission to do something else crazy with my other data, I was like, I don't need any of this. Get rid of it. Like, it's not worth it, no matter what it does or how cool it is or how much fun the kids are having with it. I don't need this in my life. But that's the way a cybersecurity professional thinks about it. And I'm the kind of guy that avoids all social media to a fault. People keep asking if they can connect with me on LinkedIn. I'm not on anything. You can't connect with me, right? But, you know, for other people, obviously, that is an impractical way to go about life. So where's the balance, as with everything else?
Fantastic. And that sort of circles back again to Kat's really good question, which is, what is that balance? So for me, I have my LinkedIn. I just use, I know that some of these other platforms are really bad. I also just use them to hide behind the fact that I'm a bit like my dad and a bit grumpy about these sorts of things. I'm like, I don't need that. I don't have time. But Tom, this was absolutely fantastic. We've got a few action items on our side to really reinforce the communications of these tremendous resources that are available through CISA. So what we will do is, not only will we get sort of today's recording up and posted, we will take the time, we'll go through the list of resources that you shared. We will make sure that they are all in that DIME sort of digital health resources library. We'll also add the NIST IoT security recommendations to everything that you shared from CISA today. Tom, thank you for taking this time with us. It was absolutely fantastic. I felt like I learned a huge amount. I appreciate you bringing this information to the DIME community. We will make sure we follow up on this. So thank you for your time. And as I said, the timing of this, the reminder of not only the import of this, but those resources that are available couldn't be better. For folks on the line, just a quick reminder about other events we have coming up. On April 7th, we are launching our 3 Ps of digital endpoints value, recommendations and resources with a public meeting. So as we start to think about the use of digital endpoints in drug approval, how are we thinking about payer evaluations of digital endpoint evidence? So that's April 7th. And then coming up April 14th, we have our next journal club, thinking about the factors that influence patients' telehealth visit satisfaction. So all critically important topics. Looking forward to those events. Tom, you were absolutely marvelous today. Again, appreciate your time. Appreciate you helping us at this with all of these resources. Thank you for everything you and the CISA team do. Very grateful for you indeed.
Oh, thank you. This was my pleasure.
Excellent. All right. Thanks so much, Tom. We'll get those all up on the website and look forward to future collaboration. Take care, everyone. Bye-bye.